This evening, more than 300 Tennesseans have died from COVID-19. At this hour, the death toll in Davidson County stands at 51 after one death overnight. Only 26 new cases reported since yesterday. That brings the total to over 4,500. More than 3,000 patients have recovered. We want to go to Dr. Alex Jahangir now with Vanderbilt University Medical Center. Joining us live, you serve on Metro's COVID-19 task force. You are the head honcho, Dr. Jahangir. So let's talk about this decision to begin phase 2 of reopening Nashville. And first of all, why is this the right time?
Well, thank you, Tracy. Good evening. This is the right time because Nashvillians have been so diligent with the safer at home and helping us flatten the curve. Our 14-day downward case trend has been going downward. We have built our public health capacity. We have lowered our transmission rate, and our hospital capacity is really good. So with all that being said, our roadmap laid out a plan, and we've met all the metrics, and so we want to open up Nashville as soon as it is safe as possible, and that day was today to announce that.
I know I'm among the thousands so thrilled that gyms are now part of phase 2 instead of phase 3. What was the thought process in opening gyms sooner rather than later?
Well, we've, as we said from the beginning, we're always going to listen to experts, the data, the science, and as we saw over the past several weeks when gyms opened at other places, gyms don't seem to be a place that has transmitted a bunch of virus thus far. I mean, we have a lot of precautions still in gyms, so I don't want you all to think that gyms are good to go full speed. But it seemed to be a reasonable place right now, as was shown by other locations. And we have a lot of experts who helped us figure out best practices in gyms. So we too love gyms, and we want to be able to get people to working out. And that's kind of what led us to that decision.
Oh, that's so good to hear. All right, I'm going to skip ahead. With so many leaving town and maybe visiting family this Memorial Day weekend, any advice for those of us with little ones or nieces and nephews who were born that we haven't gotten to hug? Is it okay if we hold new babies if everyone is healthy in the family?
Well, I think the rules for infants go for whether it's COVID or not, right? Babies, especially the first few months, really have a really weakened immune system, and you want to be careful. Fortunately, with COVID-19, the really small kids or kids in general don't seem to be impacted as bad, and the disease seems to be mild, except there is now showing to be trends of this inflammatory syndrome that happens in a very small group of kids. So there is risk to kids. I would use judgment, but I think in general, speak with your pediatrician, but I would be cautious about any disease going to a really small baby, and COVID-19 being no exclusion to that.
All right, Dr. Jahangir. Not sure what's going to happen then for those of us with little ones, but thank you so very much for your time tonight. We've got a lot more to talk about, so we will see you again at 6:45.